Hi, this is still Introduction to Nursing Research. In this discussion, we're talking about nursing research versus research in nursing. So, these two terms are actually used interchangeably by several authors, but the author Cristeta Tan has differentiated between the following terms. So, nursing research. When I talk about nursing research, they deal with the study on the process of providing care and the concomitant problems included therein. Whereas, when I talk about research in nursing, they deal with a wider study of the profession in general, including the historical, ethical, and developmental aspects of the profession. To differentiate them clearly, if I will be studying about nurses, that's research in nursing. When I'm studying about health other than nurses, that's nursing research. So when I talk about research in nursing, this is focused on the nurse, the nursing administration, and anything about nurses. So for example, if I would want to know about the quality of life of nurses working in a private hospital, that would be research in nursing. Whereas if I would want to know the efficacy between treatment A, treatment B, treatment C in the care of a patient with diabetes mellitus, that would be nursing research. If I will try to find out if the quality of life of nurses is good, average, or poor, that is research in nursing. If I would want to know, for example, if what is the perception of the staff nurses in their new boss, that is still research in nursing. If I would want to know how would mothers would react if their children have the uh, newborn screening detectable disorders, that is considered to be nursing research. So I hope that with a few examples, you'll be able to differentiate between the two. Next, what are the importance of nursing research? There are different importance to nursing research. One, it would improve health practices. Two, it would create a strategy that will bridge the gap between knowledge and practice. As a researcher, one of your roles is to merge the gap, is to meet the gap between knowledge and practice. Oftentimes we would say that what is being practiced is not actually what is being taught. That's why the purpose of research is to be inclined on evidence-based practice. When I talk about evidence-based practice, it would mean that the things that we do, okay, should be anchored to research. We don't do things because the old nurses have been doing it. Instead, we do research because this is how, or we do the procedure or intervention because this is how research recommendations would do or say. Now, research would also enhance the capability of nurses to make intelligent decisions involving the client's problem. So let's say, for example, if your patient is having difficulty of breathing in COVID-19, research would tell us what are the best interventions for these patients. Also, research would tell us that these patients or some other patients may be not compatible with a certain type of medication because of their increased risk for the side effect associated with that. Okay, that's why we would have the following importance of nursing research. Other than that, what are the goals of nursing research? One, efficiency and effectiveness in nursing care. So when I say efficiency, okay, you are maximizing the resources available to us. Effectiveness, meaning the resources or intervention that you have done is working. So when I talk about efficiency in healthcare, guys, is that it does not mean that giving everything to your patient. Because remember, you have limited number of resources for several patients that you will be taking care of. So the role of efficiency is to make the most out of these resources. Not because we have the resources, you'll maximize or use all of them. Okay, that's efficiency. Now, effectiveness. When I say effectiveness, did the patient's condition improve after you have done your intervention? Or let's say, will the patient's condition improve after you have done the surgery or after the doctor has done the surgery? So the goal is the combination of both efficiency and effectiveness in nursing care. Added to that, optimum care for clients. So when we say optimum, the maximum possible care or quality of care that your client could receive. Next, acts as a service to society based on accurate knowledge. So our role as nurses or researcher is also to educate the community. We do not just stop after we have conducted our research. A research which is just done for the purpose of submission or requirement is just a piece of paper. Next, identify clinical problems, its possible causes, and evaluate the nursing care outcomes. So what do we mean by this? For example, if you are dealing with a patient, you know that fever is one of the signs of COVID. You know that cough is one of the signs of the COVID. And you know also that there are patients who might be asymptomatic. Now, you need to try to look into statistics if what are the most common signs and symptoms experienced by this patient. That way, it will be able to help us identify the clinical problems and its possible causes. Okay, then evaluate nursing care outcomes. So what do we mean by this again? For example, if you're using, okay, let's say for example, you're using the fish skin to deal with decubitus ulcer or to deal with a burn patient. Okay, how would I know that the fish skin which is being used by the physician or dermatologist would be effective in the treatment of this patient? That will be research. Next, describe, explain, predict, and control the phenomena. Okay, so research is capable of description. Pure research is capable of describing a phenomena. For example, I would want to know the level of knowledge of staff nurses in COVID-19. Okay, the descriptive or actual research will be able to do that. Now, when I talk about explain, it would try to explain why is number two. Okay, why is question number two would have a lot of wrong responses. So how would the researcher analyze this? Okay, next, predict and control. Predict and control could be best done using your regression analysis, but there are other designs in research also that could be used for this. So what do we mean by predict and control? For example, your patient is a 65-year-old male who had cardiac arrest. Now your patient is in need for surgery. Okay, so for example, your patient would need a shunting surgery. Okay, now once the doctor will be talking to these patients, you would oftentimes hear, you are only at 10% risk of mortality. You're at 30% risk for mortality. These numbers are actually based in research. Okay, so we have the odds ratio, we have the confidence interval, and then we also have your regression analysis. So they will be able to say if by how many percentage you will be at risk, okay, for mortality when you have a certain procedure that you'll be going through. And then, of course, to implement nursing care services. Okay, so when I talk about nursing care, it should be inclined on evidence-based practice. Now, what are the possible roles of a nurse in a researcher? Okay, as a researcher, I mean. So Tan in 2011 would expound on the following possible roles of nurses in research. So there are a lot of roles wherein we can embark on. One, principal investigator. When I say principal investigator, it's like you're the lead agent. Okay, all of the research will be supervised. The entire project will be supervised by you. You are the principal investigator. Okay, who can be a principal investigator? Can anybody be just a principal investigator? So that's not the case, guys. For you to qualify as a principal investigator, you should be able, of course, to have done research. Okay, you should be able to have done research. And then this research should have been under a supervision also of an expert in research. When I say principal investigator, a student or even a fresh graduate from the BSN program is not yet entitled to be a principal investigator. Because as a principal investigator, you should have advanced master's degree. Okay, you should have advanced degrees compared to the graduates. Okay, so you have your postgraduate degree, an example of which is your master's degree. So that's a principal investigator. You oversee the entire project. Next, member of a research team. When I say member, it could be that you're the runner. Okay, it could be that you will be doing parts in the research. Let's say, for example, you'll be contributing one chapter. Okay, you'll be contributing a review of related literature. Okay, you could be a member of a research team. Next, evaluator of research findings. So, as nurses, we could sit as panel members in different kinds of research. And perhaps the question that comes into our mind is that, is this research usable? Is this research necessary to us? Will this research have a significance to us? Okay, so we evaluate. We do not just get to use research, without looking into the methodology, because there might be erroneous studies being published. So you don't just pick up a piece of paper, read it, and apply it. Okay? Another consideration that you can have is the culture where it came from. So for example, you might have seen studies in the US that says medication X is effective, and so we don't just believe it. Instead, we need to see other literatures. Next, we are also consumers of research findings. So when we say consumers, we use the finding. We should use the finding after we have evaluated it. So we are using the findings of this research to promote care to our patient. If we know from research, for example, that I need to turn my patient every 2 hours to prevent bed sore, I should be able to do it because I am a consumer of research. If I have seen, for example, that in this time of pandemic, in this time of COVID-19, my students are not coping properly, then I should devise ways to engage the coping mechanism of the students. Okay, so consumers of research. Next, client advocates in a research study. If I am a nurse, let's say for example, I am the nurse in the ward, I am not supposed the one to convince my patient to participate in a clinical trial, okay, or to participate in answering the questions. Okay, as a researcher and as a nurse, for example, per se, your patient would have autonomy. But there are times that your patient is having loss of consciousness, posible na si patient is could not able to decide for him or her own. So, as a nurse assigned to this patient, we need to make sure that the patient understands. The patient should have understand, okay, before you would push or before you would even convince that patient to participate. So legally, you are not supposed the one to convince them because your role is to protect them and to speak in their behalf. Okay, that's our role in autonomy. Next, subjects of research. We are nurses. We can be subjects in research in nursing. So for example, in your case as student nurses, I might want to do a study as to what are the factors associated with your mental health, or maybe what are the factors associated with your screen time in the internet. You are subjects of research. Or for example, when I'm talking about the staff nurses could encounter a study that would say, for example, what is your quality of life right now? What do you think is the organizational climate? So the HR may be doing this type of research. So you need to understand that from time to time, you are also a subject of research. Okay? You are the respondent. You are the participant. Next, what are the responsibilities of a beginning nurse researcher? By the time you graduate, you're not a nurse researcher expert, but you are a beginning nurse researcher. So, what are your responsibilities? Engage in nursing or health-related research. Oftentimes, you will hear people talk and talk about a certain problem and talk about the problem. Okay. As I would always mention, we do not just focus on the problem, but we should be geared towards finding solution to this problem. We identify the problem, we describe the problem in such a way that we will know how to solve the problem. Okay, so engage in nursing or health-related research. If you want to improve something, do research. Okay, you might be thinking, oh, will the improvement be immediate? Of course, it's not an immediate improvement, but at least you have done something. Next, evaluate a research study for report, as I have mentioned earlier, and then apply the research process on improving patient care. Okay, so again, the overall goal is improve patient care, improve patient experience, okay, and maximize all of this through the available resources. So these are the competencies or responsibilities, of a beginning nurse researcher. So what's a research problem? The first problem that you will have right now is that you don't have a problem yet. Do you need to look for a problem? Other than the fact that it is required in this subject, you should be able to look for a problem so that you'll be able to offer a solution to this problem. So the research problem, students would always say, my problem is that I don't have a problem. And this is the time wherein we would want problems because we would solve them. Okay, the research problem. When I talk about the research problem, dear students, In research, a problem statement is an expression of dilemma. In other words, it's not settled, it's still disputed. Okay? For example, I would say, what are the effective sleeping habits, or what are the sleeping habits of student nurses? Because oftentimes they would say they're very stressed or unable to sleep well. Okay? They think there's a lot of things to do. But then here comes me as a teacher who might be very interested to teach the student, to give them requirements in order to measure, okay, if they are indeed learning or not. So there is a dilemma. What could be better for the students? Is it really helping them? Okay? So it's a researchable problem. Second, for example, I am very worried if what is the possible treatment for COVID-19. Will the um, will the antiviral help? Do I need to prone my patient? Do I need to place my patient in mechanical ventilator? Okay, and the like. So whenever there is a struggle as to what is the real situation or what is the ideal situation, that could be a subject for research. Next, a disturbing situation that needs investigation. An example would be, let's point out, let's say, for example, you are near your household, and then they are producing a lot of noise, a very loud sounds, etc. Okay, is it a disturbing situation? If you are studying, or perhaps if you are listening to our class, that would be disturbing. Okay, so is there a possible research there? Yeah, you could find out if what are the factors associated with the sound practices, or what are the factors associated with the being loud of your neighborhood. Okay, because there is a disturbing situation. Not all disturbing situation could be subject to research, but they could be possible sources of research. So, what are the characteristics of a good research problem? There are a lot of problems, so how would I know if this problem is indeed researchable or not? One, you should be interested and qualified. It's not advisable for you to conduct a research in which you are not interested. For example, if your area of interest is in nursing, I would suggest that you need to conduct studies also related to nursing. I'm not expecting you to conduct studies about developing a certain machine, okay, which is what engineers would do. I am not also encouraging you to conduct studies about fisheries, okay, or about topics which you are not interested of unless you could collect it on health. Because if you're not interested on a certain topic, the tendency is that you'll be falling out of research. You'll end up to hate research. Next, you should be qualified. So when I talk about qualification, a primary investigator could be someone who has already completed their master's degree. In your case, you are under a supervision of a teacher who was able to complete a master's degree. That's why we are qualified to teach your research. I've also conducted the research, for example, and that's why we are also qualified to teach your research. Second, it should be important. So when I say important, it is not something that you just want to do just for the purpose of doing it. Okay, it needs to be important. There needs to be a reason. Why do I need to conduct this research? Okay, dapat may dahilan. Okay, dapat may basis tayo as to why we need to conduct this research. Others would say the social value of research. In other words, there should be a significance to the population. And when I talk about significance, this does not mean statistical significance. This does not mean that your result should say there is a significant difference or there is a significant relationship. Okay, that's different. So statistical significance and clinical significance are two different things, although they are related with one another. Next, it should be feasible. Okay, as I would give as an example, it's not possible for me to study the lived experience of a person who have been through a black hole because I have not met somebody who has been through a black hole. Okay, so it's not feasible. Next, it should be observable. When I say observable, there should be empiric evidence. Okay, it could be seen by your five senses. It could be analyzed with the aid of your five senses. It's not possible for us to measure a certain phenomenon, a certain data, or a certain event if we could not gather data from it. Okay, so when I say observable, uh, it should be seen, could be felt, could be touched, okay, it could be smelled. Okay, so those are the criteria for it to be observable. Clearly defined. An example would be mental health of student nurses in University X. What do you mean by mental health? Will it include depression? Is it level of anxiety? Is it the incidence for suicide? Because when I talk about mental health, there's a lot of topics, subtopics included that one major construct, your mental health. Another example could be effectiveness of intervention X in the management of condition A. How will you measure effectiveness? How will you measure the efficacy of a certain intervention? So you need to be more specific when you are defining this problem. Okay? That will help the reader understand where you are coming from. That will also help you later on to set the appropriate design for your research. So these are the characteristics of a good research problem, and the list goes on. Okay, the list goes on. Next, what are the ways of stating the problem? A question. Let's say, for example, what is the social quality of life of a child with epilepsy? Declarative sentence. This study aims to determine the cognitive quality of life of a child with epilepsy. Or it could also be the combination of both. Okay, so these are the different ways of stating your research problem. What are the possible sources of your research problem? There's a lot. One, issues. Okay, look around you, listen to the radio, television. There are a lot of issues. An example, why are nurses dying in the field? Why are nurses dying in the hospital setting? So for example, you might be able to conduct a study. Okay, we call it time and motion studies, wherein you sit there and then you look at the nurses, observe what they are doing, identify what could be improved in their practices. Those are issues. For example, politics is coming. What are the factors associated with the trust of people to a specific politician? Okay, that is still research. Or how do you think would health agenda or health platforms impact the choice of people when it comes to politicians, especially in this time of pandemic? Is the health agenda or the health platform of these politicians very significant if they will be voted or not? There are a lot of issues. Next, external sources. It could be a person from another school. It could be a journal. It could be other references that could tell us, there is a problem in this aspect. Third, it could be your experience. For example, you've been in the hospital and then you notice that you've been waiting a lot. Okay, let's say for example, you have waited for 2 hours and then the physician might not have been able to see you, or the nurse is too busy to entertain you. The question that comes into your mind is that, what's happening? Why am I not accommodated? Why am I not entertained here? Okay, that's your personal experience. And maybe you can conduct a research. What is the reason for the delayed turnaround time of this hospital? Is it the bulk of the patient? Is it related to the change in the COVID-19 protocols? Is it related to human factors? Okay, research could be done to that. Literature. Let's say a literature would say nurses would have poor quality of life once they had COVID-19. And let's say, for example, this study was conducted in country X. And then you came to ask yourself, is this true among Filipino nurses working in the Philippines? What could you do? You could conduct a research on the basis of that theory. Or let's say, for example, during literature review, you have seen study A. Study A says drug A is effective. Here comes study B. Study B says drug A is not effective. There is conflict of literature, and that's possible. So as a nurse, as a researcher, you could do a research to confirm which one is which. And then you have your theory. Example, we have your Florence Nightingale's theory. Okay, we might check on the Florence Nightingale and then say, what is the possible, or what do you think is the most important factor in this time of pandemic? Is it the lighting? Is it the ventilation? Is it the comfort of your patient? Or is it the food that they eat? Okay, what do you think is the most important? There are a lot of nursing theories that we could embark on. So, another characteristic of a good research problem is that, or a good problem statement is that, it's clear. it's uh, it's not ambiguous, and then the study variables are identified. So usually we would say level of stress and intent to stay among staff nurses in a government hospital in Iloilo. So you have level of stress, that's variable. Intent to stay, that's variable. Okay, so it's clear in the study. It clearly expresses the relationship between each other. So later on, we will see, while we are stating the objectives of the study, okay, that's after the statement of the problem, we'll be able to see, aha, okay, so this is how the study would want to do a relational study, a comparative study. So these are the factors that we need to look into. Other than that, it should specify the nature of the population being studied. For example, we would say level of stress and intent to stay among staff nurses in a hospital. Who is the population being studied? The staff nurses. Okay. Also, it implies the possibility for empirical testing. So, a good research statement would say this study aims to find out, okay, what is the problem, okay, or how would we quantify the level of stress. So it would want empirical testing. It would want testing that would be able to observe the problem at hand. Okay, so those are some of the characteristics of your problem statement. So when I talk about the title, it should be clear, specific. Could it just say again, mental health of student nurses? What's with mental health? Then include variables, relationship, target population, and setting. So we usually say level of anxiety and stress among student nurses in a private college of nursing in Iloilo. That means that we are conducting a study among student nurses from this institution. Should have a maximum also of 20 substantive words with function words not included in counting. So when you're counting your title, 20 is just an arbitrary guideline. Ano? Okay, because if you would look at it, if you are unable to capture it in 20 words, your participant, or I mean your reader, will not be able to capture the message of your research. Oftentimes, the readers of research would look into the title, okay? And then when they do not understand the title, and it's very lengthy, their tendency is that not to proceed to further readings about your research. That's why you have the arbitrary guideline of 30. Okay, you have the arbitrary guideline of having 20 words for this research. Okay, so your title needs to be specific. Let's say, for example, academic performance. Let's say, for example, study habits and academic performance of student nurses in a private university in Iloilo. But before you embark on student nurses study, my question to you would be, what will be the relevance of that? What will be the significance of that? Or in our case, we would usually say, so what? So what if you'll find out that there is a significant relationship? So what if there is no significant relationship? What would we do? That is how we find out for a good research problem. The types of research, for the purpose of giving you a background, will be discussed in the next recorded lecture. So there are different types of research. This is the research design is usually discussed at the middle part of research. But I'm having it here for you so that you'll have more ideas on what are the problems that you can embark on. Thank you very much for your attention in this lecture.